go. Run recording.
Okay, maybe some of you have heard of kidney disease, but most people don't know how important our kidneys are to our bodies until they stop working. Most people don't know that our kidneys remove water and waste from our bodies, make red blood cells, regulate blood pressure, and promote the growth of bone development. According to the National Kidney Foundation, over 26 American adults suffer from chronic kidney disease, and millions of others are at increased risk. Hemodialysis is what keeps many of these millions of patients alive. I'm going to discuss with you the process of hemodialysis and the importance of this to the patient. According to one of the books that I used when I became a dialysis technician, healthy kidneys remove waste and water from your blood in the form of urine. For people with renal failure, this process happens on a limited basis or not at all. When this happens, waste and blood build up in your body and can lead to hypertension or high blood pressure, vomiting, fatigue, congestive heart failure, or sometimes even death. Usually when someone experiences these symptoms, their kidney function is at 10 to 15% as compared to a normal healthy working kidney at 100%. At this stage of kidney failure, hemodialysis is usually the most common option to prolong life. According to the University of Wisconsin Transplant Program, the average waiting time for a kidney transplant is 2 to 3 years. Dialysis is the process of removing waste and water from your blood. I will now explain to you the process of hemodialysis. In hemodialysis, there are many components involved, but I will keep it as simple as I can. A dialysis machine is used along with an artificial kidney or dialyzer to clean a patient's blood. In order to clean a patient's blood through the machine, an access is needed to do so. Patients either have a catheter or another type of access that is usually placed in the arm. A catheter is basically a tube inserted via the intrajugular vein that floats halfway in the heart and part of it sticking out in the skin with ports in order to access the patient's blood. Another type of access is called a fistula, that is a vein and an artery surgically sewn together to make a larger vein in order to accommodate the large needles that we use to pull out blood and give it back to them clean. A patient's access is hooked up to a tubing that pulls blood from the patient through a pump and into the dialyzer. The dialyzer is composed of two compartments, one for your blood and one for the cleaning solution called dialysate fluid. The part where the blood enters the dialyzer is made up of hollow straws, like these, that are smaller than the human hair. They are so small in diameter that blood cells follow through them single file. As these blood cells go through the straws, smaller units like water molecules and waste products are pulled through the pores of these straws and are washed away. This process is known as diffusion. Think of this process as diffusion as a tea bag in a cup of hot water. The tea diffuses from a higher concentration in the tea bag to a lower concentration in the water. The waste products and extra fluid is then washed away and given back to the patient clean via the other end of tubing through the patient's access, either the catheter or the fistula that they have. This cleaning process can take upwards of 5.5 hours to 4 times a week, but usually the regular time is 3 to 4 hours 3 times a week. Dialysis is really a part-time job for some of these patients. Patients also need to do their part in keeping healthy to receive the full effects of dialysis. This includes limiting their fluid intake every day to only 1.5 liters of any type of fluid. This is important to limit fluid since fluid gain between treatments occurs because their kidneys can no longer remove fluid. Also, patients have to limit their potassium, phosphorus, and sodium intake during treatments since dialysis can only remove certain amounts of these types of toxins. This is why it is important that a dialysis patient limit their fluid intake and watch their diet. Hemodialysis is one of the several things that keep end-stage renal disease patients alive. I like my job as being a dialysis technician and helping prolong the patient's lives. If you are one of the millions of Americans who are at risk for kidney disease, the National Kidney Foundation offers free screenings to people with diabetes or a family history of kidney disease. So take care of your kidneys. They do a lot more than you think they do. Thank you.
Yay!
You can stand, guys.
That is why you should not try to overdose on Tylenol.